Hello?
Yes.
I feel as if you low-key be writing questions for the boards, like for real. I feel as if you be writing questions for the boards.
Oh, really?
Let me tell you, I was sitting like earlier when he was teaching, and I'm like, is this man really writing for the boards and not letting us know? I was sitting in the taking my boards, and like a lot of stuff that you went over, like you was talking about this old manatal and stuff, and I was just sitting, I was just smiling. I'm like, are you kidding me? I'm like, I was just smiling from ear to ear. Like you touch on so much stuff today that literally show up. And the thing is, as I said earlier, they're not giving us the answer that we know, because they know that everybody know that. So they're not gonna give you that. They want you to think. So you look into the answer choices and you're like, oh my gosh, I don't see this, I don't see that. But you have to know sometimes they're trying to trick you, because you get like half of the answer is correct and the other half is incorrect. So if the entire thing is not correct, don't choose it. That's what I did. And when I say I read the question and I look away, I didn't look at the answer choice. And then I remember, like, what is it I know about this disease? And like when you're studying, like if you're doing like PAD and PVD, you do it side and side. So you know the difference, because like for the select all that apply, it's sign and symptoms, it's risk factors, and it is teaching. And you have to like read the answer choices real good. Like you have to look at the question and like, what is it I can do now for this patient? Because I'm telling you, they will try to like get you. But as I say, content is content. And once you know to attack the question, you should be fine. If I wasn't sure, I'm not choosing that answer. I'm like, I will take the two that I'm sure of than to choose one more, then I'm going to end up with a zero.
Yeah.
So, so like when you're teaching, like, that's what I was telling them, like, pay attention, because you know what you're talking about and it's sinking. Because I watch like a lot of your videos and I kind of like go over and I did things differently this time around, because I studied earlier and I pray. I pray before I study, and I use like a different test bank. And this test bank that I use, it prepare me better than the other two, because it's like the categories. You understand? So I could see, one was improving, and I think that really helped. So I'm just like, don't change the answer. Like, make sure you're solid with that answer and you choose it, because you don't want to go back and change your answer. But as I tell them, like, we can like create a group and I can like, study with them, and then they can still come with you like during the week. You understand? So we're gonna figure it out, because I don't want to be selfish. And just want to like, I help them when them pass, them can help somebody else, and that's it. So I just want to say thank you again. So guys, the person who's gonna do the link, just get the information and then we can figure it out tomorrow. I'm gonna be here tomorrow and then we can take it from there, okay?
I don't write questions. I just know like the most important critical information. I'm not one of them.